everybody. So it is my honor that Dr. Maruthu is going to talk today on behalf of the Chancellor, Madam Chancellor, Board of Members, Vice Chancellor, and our administration. I have the great pleasure in welcoming Dr. Maruthu to and also introduce him to the audience. And I am thankful to all those participants who are gathered here to listen to this important topic. As Deepa has said, it is a very important topic because on and off we are daily basis we are seeing so many road traffic accidents. It may be mistake in the road, or it may be human error, it may be anything. But the life is lost, and it may cause collateral damages both to the individual, family, and everything. So, such an important topic, he will be talking and concentrating mostly on the human cost of this road traffic accident. And Dr. Maruthu has been graduated and postgraduate from Thanjavur Medical College, and he has done his MCH in vascular surgery, probably from Chennai. I'm not very sure from, but he is a very well-known vascular surgeon. He has written two books on various aspects and published papers in other journals. And he was a professor and started the Department of Vascular Surgery in Thanjavur Medical College. And later he became the dean. And it is very important not that during the COVID, he was the dean. He must have been busy in managing the patients because COVID had a lot of issues, human issues as well as medical issues. And after retirement, he is with the NHM, where he is working, and he's an important person who dealing with the road traffic accident. So, thank you very much, sir, for accepting our invitation. We are in the 93rd episode, I think. We are doing this every Friday for almost 2 years now after the COVID has started, and it is very popular. And normally around 250 to 300 people join. So as the time passes, people will join. So welcome you, sir, and over to Dr. Deepa to initiate the program. Dr. Deepa, you can start the slides so that sir can start.
A very good afternoon, all the faculty, Puducherry, and the scientific committee which is organizing this WebEx and focusing on pioneer areas of interest in public health. And under the criteria of public health issues, we have taken up road traffic accidents. And what is the cost of human life is the question which I have been asked to delve into. A very difficult question for which I don't have a direct answer, but I have the data to present before you for you to ponder as to what is the real cost of human life on the roads. And as even before I begin the talk, I have the unique experience of talking on this topic, sitting on the front seat of my car, being driven by my very disciplined driver, and my esteemed colleagues who have permitted me to be here with my presentation, sitting in the back. More importantly, I wish I had the strict regimentation with which I had to strictly adhere to after giving commitment to talk on this particular topic today. I had a very important assignment to attend to at Vellore I was really doubtful whether I can come back in time. I even contacted Madam Dr. Mahalakshmi. Sir, it cannot be changed. A rule is a rule, was the unsaid answer. A rule is a rule. Agreed. Now the question that I'm just raising is, as I am traveling on this road with vehicles in front of me, vehicles behind me, vehicles on the opposite side, and the various behaviors of people, as well as the drivers and the vehicles on the road, I just only extrapolate the answer which I had from your institution, a rule is a rule, whether it gets applied in spirit on the roads when it comes to our traffic regulations. A rule is a rule. Is it respected? Is it strictly adhered to? Is it given relevance? Is it repeatedly pointed out? Are we conscious of the traffic regulations which are on paper? Is it put to practice every moment when we have lakhs and lakhs of vehicles on our roads and lakhs and lakhs of people moving? And what is happening? I'll just I will just give the narrative of Innuir Kappom Nammai Kakkum 48 scheme, which was inaugurated by our Honorable Chief Minister of Tamil Nadu on December 18th, 2021. And after the scheme was launched, I have this one case to present before you for you to understand the relevance of this scheme as well as the message that this patient is going to give us. Can I have the next slide, please? Yeah, this is a young 24-year-old young man from Coimbatore, a very good cricket player who was supposed to go to Rajasthan the next week in the 4th week of December when he was riding a two-wheeler from Pollachi. Next slide. Next slide. Yes. So Mr. Mohan Kumar, 21 years old, he fell from a bike. The reason he fell from a bike was not overspeeding, not being under the influence of alcohol, not any traffic violations, but the one fault on his side was that he was not wearing a helmet. The one person, a pedestrian, jumped over the median from the opposite side to run across the road. In order to avoid hitting him, this young man, he tried to avoid hitting him, and in the process, he had to suffer a major skid, and he fell down, and he suffered a polytrauma at about near Apology. The patient was immediately taken to the. So he was referred to a higher center. Next slide, please. Next slide. Yes. This patient, before reaching one of the empaneled hospitals under Innuir Kappam Thittam, he went to another private hospital wherein the hospital told the family that all the cost of saving his life would run into nearly 40 to 50 lakhs, given the seriousness of injuries. That was what the answer given at the hospital. And not knowing what to do, the patients wheeled out of the hospital and came to Ganga Hospital, one of our empanel hospitals at Coimbatore. He had a right people dilated and not reacting. and patient had a pan-facial fracture, and he had a completely slit base of the skull had been completely slit open, and the oropharynx was so much torn that you could see the trachea, and he had a fractured mandible. It was a completely dismantled facial structure, and he had a completely slit nasal cavity also. And the next slide, next slide. And he had the right optic nerve also completely disconnected. It had a completely disconnected, and this was the seriousness of the injury. And in consumed the afternoon food that he had consumed in the vomitus, the entire food residue was lying on the base of the skull, the brain exposed. That was the condition when the patient was brought into the hospital. Next slide. Yes. So this CT scan shows the nature of the fractures that the patient had suffered. And next slide. Completely the nasal cavity, the oral cavity, maxilla, mandible, and the roof of the floor of the orbit, the frontal bone. Next slide. Yes. So patient had to be intubated at the emergency room, and he was immediately wheeled to the OT, operation theater. Next slide. So on the day of accident, 22nd, he was initially resuscitated in the emergency room, and then immediately wheeling into the theater at the middle of the night. Exploration of cranial cavity and removal of foreign bodies was done from the base of brain, and all the shattered bone pieces in the vortex, it was removed. Facial debridement was done, and then internal fixation of frontal bone, nasoesophageal complex reconstruction was done. And then on 24th, and he also underwent neuroplasty. 24th, patient underwent a tracheostomy. 25th, the third sitting, patient underwent mandible and maxilla fixation. Subsequently, what happened was, patient developed a copious CSF rhinorrhea and CSF autoria also. So that had to be arrested, and the patient was taken up for a temporal craniotomy, and a neuroplasty was done the fourth sitting, and the patient was in ICU for 10 days under ventilator support. And these are all the bone pieces which had been removed that particular night after the accident. Frontal craniotomy, fronto-naso-orbito-ethmoidal complex fracture fixation was done. The surgery lasted 5 hours. Next slide. So these are the various bone pieces removed. Now, given the injury and the presentation of almost 4 hours, 4.5 hours, 4 hours, patient not knowing where to go, and one hospital quoting that the total treatment cost would surpass 40 to 50 lakhs. This patient from a family wherein he had lost his father, he had a mother was an agricultural laborer, and he is graduated and he's waiting for a job, and a sister after him waiting for marriage. This is his family condition. What would it cost to save his life? So these are all the bone pieces which have been removed. Next slide. And you can see the coriander leaves, the cauliflower, the chicken pieces from the afternoon lunch. So neuroplasty followed by fixation of fractures of fronto-naso-orbital ethmoidal complex, and then temporal fascia used for neuroplasty. It was done. Yes, this is a reconstructed facies after four surgeries, and and he was on ventilator support with high-end antibiotics and strict monitoring. And on 24th, he had a percutaneous tracheostomy because of the multiple procedures, and he needed a prolonged ventilator support. And then the fixation of all facial fractures, 5 hours surgery. This was done. And next slide. In intensive care, CSF leak, for which he underwent again a neuroplasty. It was mainly CSF autoria. Nasal leak had almost stopped, and had to take a call to intervene again, given the copious amount of CSF autoria. It was almost about 500 ml per day. Temporal craniotomy and neuroplasty was done. Temporal bone fractures fixed. Loose fragments removed, and again a neuroplasty was done. And later the CSF autoria came down to 100 ml, and the surgery lasted for. Next slide. So these are all the various neurosurgical interventions done to clear the fractured bones fragments lying across. And on 1st January 2022, this patient woke up and he greeted us, showing up a thumbs up sign, and he wanted to talk. What he wanted to say, I will tell you. And this is this young man after 5 surgeries. Next slide. In fact, on March, in the first week of March, he came down to Chennai. Next slide. To meet our Honorable Chief Minister, and they thanked the government of Tamil Nadu because his entire treatment, all these 5 surgeries, each surgery running into 4 hours, 5 hours, and done at a private facility, not just not a government facility, done by a government facility, completely free of cost. And this patient is now back to his completely preserved cricketing skills, and he is yearning to join the national team also. He is a very gifted cricket player, and his life has been saved. Now, plus the human cost of road traffic accidents, if this patient who suffered a road traffic accident for no fault of his, except that he was not wearing a helmet, but by a pedestrian who violated all regulations to run across, jump over the road median to cross the road on the opposite side, wherein he made this youngster fall on the road. And but for the intervention taken up by Ganga Hospital under Tamil Nadu government's initiative of Innur Kappom, Nammai Kakkam 48, this young life would have been lost. And today he is walking, and what he had to say, I will tell at the end of the my presentation. We'll go to the next slide. Next slide.
Shiva, please change the slide.
Please change the slide. Next slide.
I think he's having.
Yeah. Yes, please.
They are trying to make it full.
Tamil Nadu today tops the number of deaths in road traffic accidents in the country. It tops the country. In fact, it is followed by Madhya Pradesh, Uttar Pradesh, Kerala. Tamil Nadu tops the list of states in the maximum number of lives lost on road traffic accidents. Next slide. And on an average, around 1,450 to 1,500 lives are lost every month. Every month, around 1,500 lives are lost. That means every day we are losing about 50 patients on the road. 50 precious lives are being crushed, or being bled, or being torn, or being broken to death on the roads. 50 lives every day. Next slide. Next slide.
Slide is not moving.
Next slide. Yeah. Yes. Now, the slide is not moving. Yes. The demand for emergency medical services has increased with the increasing number of accidents. Tamilnadu has a very robust system of addressal as far as this menace of a public issue, that is road traffic accidents, is concerned, wherein we have a very robust pre-hospital patient transportation system with a well-activated and a well-coordinated 108 ambulance system in place. We have mapped the entire area of Tamil Nadu, and we have identified what are all the hotspots as far as accidents are concerned, places where we have been having recurrent accidents, places where more number of lives have been lost. So we have a very robust system of pre-hospital patient transportation system in place, and the system operates around the clock. But the worry factor is the calls received for emergency medical services is on a constant increase. It shows that the accident number, the number of accidents is on a perpetual increase, and the demand is also increasing on a perpetual increase. Next slide. If you analyze the causes of accidents, cause these accidents, in 82% of instances, overspeeding has been found to be the cause of accidents. Most of us just think that it is alcohol, or it is not wearing a helmet or anything, but it is overspeeding which is responsible for accidents in 82% of instances. And jumping red lights, driving on wrong side, drunken driving, and use of mobile phones and other causes. All these account for the majority of accidents. But remember, overspeeding is the leading cause of road traffic accidents. Next slide. Now, an accident happens. I'm just going to speak the plain truth now. Just let us imagine someone has taken alcohol and has hit against somebody. The person has died, and this person is taken up by the police, and reporting is done. And now comes in the question of insurance claim for the accident vehicle, and as well as the third-party insurance. If the cause is mentioned as drunken driving, no insurance benefit will reach the either the dead deceased person or the injured vehicle's owner, or for the injured vehicle, for the damaged vehicle. So what happens is the insurance claim implications alters the cause of accident mentioned in the FIR, and this is a serious impediment in addressing the real cause of accidents and trying to find solutions. These are all the various issues which we have identified, that never the truth is said as far as accidents are concerned. It is always the larger vehicle which is responsible for causing the accident. If it is a pedestrian versus two-wheeler, the report will always say the two-wheeler was at fault. But in actual reality, It's the pedestrian who would have been at fault, causing the fall of the person who was riding the two-wheeler, as I said in the case of Mohan Kumar, the patient treated at Coimbatore. So we have certain established practices of not telling the truth when it comes to road traffic accidents. And the most commonly repeated untruth is that the cause of accident, the truth is never mentioned, and insurance claims and insurance concerns always dictates different reasons as cause for accident for them to stake claim for the insurance money. This is one real factor which we need to take note. Next slide. Recently, as we analyzed the various causes of accidents and found out how we can go about it, 5 departments on behalf of the government of Tamil Nadu sat together under the aegis of Indian Institute of Technology, and we took up from vehicle engineering, from road engineering, from enforcement wing, from emergency care, that is health department, and then public behavior education. So all these 5 E's we sat together and discussed as to what are the major causes which are correctable and which need to be addressed. A detailed analysis was done. Most important component, the missing link was we had very many reasons coming under each of these categories of E, and we had answers also to attend. But the most important E, for which we don't have a government department, is the most basic requirement of empathy, human empathy, which is the most important preventive element which can minimize the number of lives lost or minimize the number of damages that are being daily incurred to the society at large. What happened to the human empathy on the roads is one serious question for which we had no answer. The road ego, the various aspects of human behavior on roads, and the increasing incidence of accidents every day, day in and day out, constantly happening, very repeatedly being reported on the media, both print and electronic. What has done to the civil society at large? It has in fact caused an effect of desensitizing the society, and we become totally insensitive when an accident happens near us, unless it is someone very much known to us or some very related to us. Most often what has happened to the civic behavior after an accident is, that is why the Honorable Supreme Court of India took up this and brought in what should be done. If suppose an onlooker or a good Samaritan who comes in to help, suppose this person is being taken for a ride under the existing legal implications. That is why the Supreme Court of India, they have constituted a committee for addressing road safety on the larger perspective at the country level, and it has also given instruction to the states. And it is in this background that the recently enacted, recently constituted Road Safety Authority and Emergency Medical Services Act of Government of Tamil Nadu is trying to address this particular issue. If anybody who comes to help a road traffic victim as a good Samaritan will be given legal protection, and the fear of legal harassment should not block people in rushing to the help of people who have faced accidents. It is in this background that even this enactment of law has been done. So the most important missing component is empathy, respect for human life. A fellow human who is traveling, and responsible handling of the vehicle, responsible use of the road, and respecting the established traffic regulations and strict adherence to a disciplined behavior all take from the component of next slide. So, for example, we have different kinds of roads, from panchayat roads to state roads, state highways to national highways, 4 lanes, 6 lanes. Of all these categories of roads that we have invented, maximum number of accidents occur on the 4-lane national highways. The reason is the road engineering, when it does not address a laterally joining a T junction or providing not providing a service lane at these places, accidents which have been studied, bad road engineering has been found to be the most important cause for recurring accidents, and especially the judicious use of road furniture and the people out of societal behavior or an impulsive drive to jump the road to cross over to the other side without traveling half a kilometer to cross over to the opposite side. These errant behaviors have been the causes for recurrent accidents, and all these take origin only from the basic the element of empathy as well as empathy not only to the person around, empathy to our own life. All that take root on the basic question, the cost of human life on roads. When we attach value to our life, when we attach value to the other man's life on the roads, we can prevent accidents. When we do not take note of it, or when we take it for granted, that is when the tendency to accidents happen. Next slide. You can see this accident, and this is a very strange accident which happened on Kodaikanal Road. This person who is hanging in the air on the electric wires, in fact, was a pillion rider sitting behind his friend. The speed at which the vehicle was traveling, and after the crash, the speed virtually threw this person who was sitting pillion up in the air, who was hit by the overriding electrical connections, and this is how he was found dead in the mid-air. Is this accident not preventable? What law can prevent these accidents? Unless you attach value to your own life as well as to the life on the road. Next slide. And not only this, after the accident, post-crash care, the treatment cost for saving a life, as I said in the example of Mohan Kumar, it would have cost almost 40 to 50 lakhs. Since the government of Tamil Nadu had a vision to come up with a program of post-crash, completely cashless, free care for all road traffic accidents, this scheme in fact applies to all the travelers on Tamil Nadu roads, irrespective of the country from which the individual has come, or irrespective of the state from which he has come, whether rich or poor, whether he has got a card or not. For the first 48 hours, all life-saving procedures, we have formulated a list of 81 procedures which are essential for us life-saving medical procedures. And for these 81 procedures, the government of Tamil Nadu provides cashless free to all road traffic accidents in 642 empaneled hospitals, of which 412 are private hospitals and the rest are government hospitals. And till this date, this scheme from December itself has treated more than 60,000 patients, and we have tasted initial success in reducing the number of lives being lost. This has been done only by coordinating the pre-hospital patient transfer, and in fact our emergency technicians in our ambulances are well trained to resuscitate the patient, both cardiac as well as IV transfusions, including blood transfusion and tourniquet arresting bleeding, and we have given training, and we have both advanced life support ambulances with emergency technicians to effectively transfer patients from accident site to the nearest hospital. What we have done, in fact, is we have done the mapping of the state of Tamil Nadu based on the grid identification which we have done. 500 grids we have identified, and at these 500 grids, we have ensured stationing of ambulances so that on receipt of a call after an accident, our ambulance will reach the spot within 8 minutes. As of today, it was 12 minutes. We have aimed to bring it down to 8 minutes. So within 8 minutes, the ambulance will reach the accident spot, and the patient will be transported to the nearest medical facility, which we have already predetermined identified hospitals. And we have a system of pre-arrival intimation from the ambulance to the hospital to ensure that the hospital and the emergency room is kept in a state of readiness to receive the patient, resuscitate, triage, and then we categorize the patients into red zone, yellow zone, and green zone. Whereas green zones can be treated as outpatients, and red zone patients require multidisciplinary evaluation and intervention. And we have also kept time limits for from triage to specialist opinion. Everything should be done within 30 minutes. And yeah, side by side resuscitation also goes in. And after 30 minutes, within 2 hours, the complete evaluation of the patient would be done. And we have also fixed a guideline to take up patients who need intervention in the form of either general surgical intervention or orthopedic intervention or neurosurgical intervention or vascular intervention or a plastic or a cardiothoracic intervention to be done within 6 hours. So within 6 hours, we have also created facilities, and all this has been facilitated by creation of what is called Tamilnadu Accident and Emergency Care Initiative, wherein we have crafted scientifically based protocols, and we have trained our staff nurses as well as the emergency team. In fact, the age-old landmark of a government hospital casualty has been replaced by an emergency department, and this emergency department is now run 24 hours. The system is very much protocol based. In fact, most of the procedures in the Tamil Nadu Accident Emergency Care Initiative, the emergency department is nurse centric. In fact, once the patient road traffic accident reaches the hospital, the triage nurse, she does the entries. We have live reporting of all the trauma patients, and it is monitored by the state on receipt of information, and a database analysis of the numbers as well as the trends are being studied. And wherever there is gap, we take immediate note of it and try to address it appropriately. And the reason that we are telling the financial burden here in this slide is the cost of the financial burden for post-crash course is enormous, and it has landed many families in abject poverty. In fact, the recent definition which I would like to quote here is poverty. The recent definition is just to many families of the middle class segment in India, poverty is just one hospital bill away. Especially after an emergency like a road traffic accident. The families should not be pushed into a state of poverty for because of medical care. Is the primary reason Government of Tamil Nadu took up the scheme and formulated the first of its kind program in the country to give cashless treatment to all accident hit victims on Tamil Nadu roads as life-saving procedure for the first 48 hours, which is called Innuir Kappom Nammai Kakkum 48. Next slide. Next slide. So this is the scheme that we have drafted. Next slide. Yeah. Actually, road safety is not just the responsibility of one department. It's not just the transport department. We have the engineering department. We have the motor vehicle department. We have the enforcement department, namely the police, and we have the emergency department who are responsible for post-crash care. But accident prevention is entirely different from post-crash care. Post-crash care, we have advanced enormously, and the facilities which we have created both in the private as well as in the government sector, really we can boast of. But what is needed is our focus on accident prevention. Accident prevention should receive our primary attention, and the energies that are being spent on injured patients and the cost of the state exchequer as well as the cost to individual families in caring for the injured is enormous, which only I said in the beginning of my presentation today that it's a difficult question for which I don't have a direct answer. Next slide. This component, this scheme has got 5 components. This Inuit poem is not just post-crash care. We have enunciated principles to address it in a very comprehensive manner. The 5 components of the scheme are: number 1, creation of a road safety authority in order to address the reasons responsible for repeated accidents. It may be road engineering cause, it may be a human error, it may be a vehicle fault, or it may be lack of medical facility nearby, or it may be a civilian indifference. Whatever be the cause, we need to address it. So the Tamil Nadu government has taken up creating a road safety authority. This is the first component. And second component is enactment of Emergency Medical Services Act in order to arrive at standard protocols for providing care for an accident hit victim, as well as to provide legal protection for the good Samaritans who come to help the injured. This is component number 2. Component number 3 is the Nammai Kakkum 48 for the post-crash victims, wherein we plan to create the best of facilities for road traffic accidents. This is the third component, Nammai Kakkum 48. And the road engineering is, we aim at fair roads. All our roads should be fair. Fair in the sense, fatal accidents, incidents reduction. Fatal accident incidents reduction is the abbreviation, the acronym that we have used. The roads should be fair in the sense that we have a disciplined behavior on the roads by ensuring that all the components of a safe road are addressed. It may be an engineering cause, or it may be providing a service lane, or it may be enforcement of the road traffic principles on the roads. By incorporating the various components to ensure that a responsible behavior is ensured on the roads, the Tamil Nadu government has envisioned fair roads. This is the 4th component. And the 5th component of the scheme is Udavi Sei. Udavi Sei is, here we aim to train the first responders who are on the roadside, who may be coming in to help the road traffic accident victims. So in order to give them training in emergency care, we have entered into an agreement with various NGOs who have done pioneering work in these areas in their places. They have done enormous work. For example, in Coimbatore, Kutti Cop scheme by Rotary Coimbatore, they have done a very good initiative. And in Chennai also, we have interacted with various NGOs, agency called Alert. They have trained more than 1,000 youths on first aid for road traffic accident victims. It only shows that various people at various places, right from the apex court of the country to small NGOs in little small towns to corporate places, big business houses have caught the idea, but the pooling of all these resources and charting out how best we can address this menace of road traffic accidents, whereby we are losing various lives, we should put a stop. And in order to help towards this, integrating all these people and training the first responders after road traffic accidents in order to provide help for the accident victims is the fifth component of the scheme, that is Udavi Saitittam. So encompassing all these 5 components, we have put up the Innuir Kappom scheme of Government of Tamil Nadu. It only shows that the government is fully seized of the seriousness of road traffic accident, which has become a very serious public health issue because of various factors. And let us come face to face it. Let us speak the truth and let us ensure responsible behavior of the public, and let us ensure that our roads are fair by the help of everyone in ensuring that our road journeys are safe. And now the next slide. So we have also aimed to incorporate the Department of Education by bringing in road safety in the curriculum for school and college students, and providing basic life support training for interested public and college students, first responders, and then providing basic life support training for police personnel in patrols and public servants along the highways. Because as many lives that we are saving from dreaded diseases by our pulling our best resources and our best hands, so many lives are more than the number of lives we are losing on the roads because of road traffic accidents. It has caught the attention of government as well as all the key thinkers in our scheme of things. We only hope to put at least an arresting trend to these increasing incidents of accidents. Next slide. I have almost come to the concluding part of my presentation. And I want to tell now what Mohan Kumar had to say. After being discharged after 21 days, after this series of 5 surgeries, both to the generosity of the hospital, which took no money from the individual, and Government of Tamil Nadu, which partly footed the bill of treating this patient, the boy coming out of this hospital came and said, "Sir, I have lost my one eye. I have no vision in my right eye, and many will not recognize my new face. But after I regained the consciousness, then I understood how valuable my life is. But for the efforts of Government of Tamil Nadu and all of you together to save my life, I would have never known what the value of my life is. I will really lead a very good life, both to my family as well as to society. And I want to spend the rest of my family in telling people the significance of wearing helmet, which would have saved my badly injured head and face." That's what he said. And that is the message. And let us listen to what Mahatma Gandhi, father of our nation, said. "Live as if you were to die tomorrow. Learn as if you were to live forever." We are all running on the roads very fast, very, in fact, very spirited, as if that our life is going to end tomorrow. It is not so. The opportunities that has been given to us, the mechanisms which are available around us, which has given us a life that we are alive today. Let us learn from the mistakes of others. All the people who have lost their life on the roads, Everybody has a story to tell us. Everybody has got a lesson to tell us. A wise man learns from the mistakes of others and does not commit the mistake by himself to learn that lesson. Let us be wise. Let us not prove others otherwise. Thank you very much.
Thank you, sir. It was a very informative talk. Actually, today we are in this. Today we are at the 92nd episode, sir. So today I
Yeah.
felt among all the episodes which we had, this was really a fruitful discussion, which was unaddressed. Thank you, sir. Thank you very much. You have started your presentation with the history of a young cricketer who met with a road
Yes.
traffic accident, which was efficiently managed by the teamwork. Not only
Yes.
him, all the cricket lovers here are also thankful to you, sir. It has been a
Thank you.
great accomplishment done by the team, which have here all the undergraduate students and the other people will also be thinking about that how bad the accident was, because
Yes.
the road traffic accident, the cost is not only life, sometimes it is the quality of life, sometimes it is a happiness. Each of us would have had a different experience to say regarding this. As a medico, we all should have, I think most of them will be ready to help you out with this initiative which you have started with it, which was a very great initiative, Tamilnadu Accident and Emergency Care Initiative, which has tried to put our Tamil Nadu in that statistics to come down, sir, which you have
Yes.
showed a high number of road traffic accident among the other states. It looked like
Yes.
family welfare and other things. Road traffic accident, how come we are staying high? And you have
Yes.
enumerated few of the data which was not reflected in the data, like mobile usage, hit and run, and accidents involving the pedestrians. Like we see in the when the signal is there, the pedestrians are never concerned about the signals. Other people will be waiting, and finally, either themselves or the people those who are traveling in the correct path also get themselves hit. And you have
Yes.
highlighted the strategies to improve the survival by prompt
Yes.
transporting the patients in emergency medicine, and how it is intimated to the nearby hospital and emergency medical care, and how triage is being done. And right now, every medical college, we also have changed our casualty into emergency medicine department with a multidisciplinary approach. The emergency medicine department, as per the new NMC guidelines, have to be in full proper this one. So to receive all these trauma patients and to give effective treatment for them. And your entire system, which you have mentioned, like road safety authority and Inuir Kapam Thitam 48 within to save within 48 hours, everything have been very much informative, sir. And finally, your initiative like road to have this as a curriculum in the school and college students, that is really great. And BLS, I think, I hope it has been started all over, sir, to whomever have
Yes.
been interested. Already, I think it have been started, because I saw in newspaper also, even in the local newspaper, that police people are being taught, and other college students who are interested are also taught. And we have
Fine.
many queries also in the chat box, sir. Can you take
Yes,
these
please.
questions, sir?
Yeah, I'm willing to take questions. Professor,
Sir, but sir had a question.
but
But
sir,
sir, can you please tell you?
but sir, Professor, but you can please tell the questions. I will answer, sir, please.
Yeah, so it was a very interesting talk, as Deepa madam was telling. You started with telling the rules to be followed, but I think the tragedy is majority of the people do not follow the rules. I think that may be one of the issues.
Yes,
And you said about the Tamil Nadu highest in the accident. So
yes.
is it more related to the condition of the road, or people are not following the rules, or both combined, which is the major issue?
The major causes are overspeeding and bad road engineering and bad road behavior by the public, sir. These three are the killer combination is the three.
Yeah.
At the T junction of a highway, a overspeeding vehicle on one side, and an irresponsible road crossing, or a very indiscriminate road crossing, and stray animals on the roads. These are all the causes which cause most often the most grievous injuries and
Yes.
mortalities on the roads. Yes, sir.
This Tamil Nadu emergency scheme you said.
Yes, sir.
So they have to go to the empaneled hospital. So must have done it in such a way that people will reach in 8 minutes, or
Yes.
they can
What
go
we
in.
have done, no, sir. We have mapped the entire area, and we have in fact drafted a district road safety plan with the district collectors, led by the district collector. Each district, we have given them the grids, accident grids identified in each district to district collectors, and we have asked them to draft on the available facilities, both government and private in their district. And from this grid, how much time it would take. We have taken inputs from various districts, as well as our 24 hours monitored 108 scheme in the in our headquarters. Based on that also, as well as we have also taken inputs from both IIT and as well as from Ministry of Road Transport and Highways, Government of India. Based on all the integrated information from all these sources, we have done the mapping of accident grids, and the nearest hospital facilities we have identified and them roped in, sir.
This emergency number is 181 or something
It
different?
is 108, 108.
So
And
very
there is
nice
another
evening,
question.
sir.
Yeah,
Yes, sir.
Professor Mahadevan is there, former Dean of JIPMA. I think he wants to ask something. Yeah, Mahadevan.
Yes, sir, please, sir.
Mahadevan.
Sir, Dr. Mahadevan, sir, your views, please. The sir has given many questions in the chat box.
Chat box. Sir, shall I go to the chat box and see the questions, or I'll wait for Mr.
No,
Bhatt?
sir, we have
Dr.
been
Bhatt to
asking that. Sir, have been asking his questions, few of the questions like, sir, Dr. Mahadevan, sir?
Mahadevan is not audible.
Have they integrated this with the CM insurance scheme? That's the.
Yes, sir. We have integrated, sir. Actually, the first 48 hours scheme is first 48 hours cashless treatment applies to all.
All.
That is done by the government of Tamil Nadu on assurance mode, and we coordinate the work. After 48 hours, it is integrated with the CMCHIS, and further care of the patient and any definitive interventions which are needed will be taken up under CMCHIS after 48 hours.
Yes,
this is how we have done the integration, sir. And we are also ready to evolve. We are evolving, and we are willing to receive suggestions from learned quarters like your institution, and any valuable inputs we'll be taking and we'll be incorporating in our future practice, sir.
Thank you, sir. Because Dr. Christopher Amlorpam, he was telling that they are trying to take the experience to integrate it with the insurance scheme. It may take some time after they work out the budgets.
No, we have already done integration, sir. Thank you, sir. Thank you, sir. Thank you, sir.
Dr. Mahadevan, sir, has given that this thing that Tamil Nadu Accident and Emergency Care Initiative is a great initiative by you, sir. He has given the remarks to you. In the chat box, it was given, sir.
Thank you. Thank you. Thank you.
With your vast experience and personal commitment, I think the talk was very well received. There is one question on overtaking from the wrong side.
Dr. Mishra sir from ophthalmology.
Tamil Nadu people, this rule is not strictly followed, so people overtake from the wrong side, and they don't wear helmet. See, in Pondicherry also, it is not strict that, especially two-wheelers, they need not wear helmet. Of course, their explanation may be that. So these probably we need to enforce when the people do not follow the rules. Probably it need to be enforced.
I will add my input. This is my personal input, sir. Whatever is enforced is always rejected, sir. Whatever is enforced will be strictly, it will be rejected. What is needed is not enforcement. What is needed is only an awareness. An awareness when it takes from the individual by becoming increasingly aware of the value of his life or the value of his contribution to preserving others' lives, which can take root only from the faculty of empathy. That is what that is the only answer I can give, because this empathy cannot be enforced. This cannot be activated by government order. It cannot be summoned by a court order. all that it takes is the awareness, which I would say the definition of health, which means complete physical, mental, social, psychological well-being, and there is another component including the spiritual well-being of the individual. That is also a component of definition of health. Unfortunately, the component of spiritual well-being is confused with religious belief or religious disbelief. It has got nothing to do with religion. Religion and religiosity is a completely different subject, and spirituality is is completely different. And spirituality is nothing but being empathetic and being aware. That's all I can say. And this can be addressed only by the individual, by unfolding on a deep inner search, or from a very focused, objective observation. That is all I can answer. Beyond that, I don't have any answers.
Although we say that we need to give protection to the person who is helping, but
Yeah.
I think completely the problem is not over, because the moment you help, they will ask you to come to police station, give statement.
No, sir, no, sir, no, please.
Yes.
In fact, towards the Inur Kapom, we have activated only the post-crash emergency care. We have activated. The other components are in the formative and compiling stage. It will take a few months to get the Emergency Medical Services Act, Constitution of Road Safety Authority, and guidelines for fair roads, and Udavi Sai Tittam. All these will take some more time to come to fruition. And once it comes, we have taken enough attention to address the issues of Good Samaritans, and the harassment from police and legal side will not be there.
Thank you very much, sir. Very
Thank you, sir.
interesting. I think you
Thank
will
you, sir.
lead the country, Tamil Nadu. I think your activities will lead the country.
May your blessings come true and bring pride to our people, our state, and our government, and our Honorable Chief Minister of Tamil Nadu, who has shown personal interest in conducting meetings on road safety.
Dr. Deepa, you can take over.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you, madam. Thank you, madam.
Thank you, Dr. Mahadevan. Thank you, sir, for taking your time. I understand how much you were busy. You have been traveling, but in spite of that, you took your time to spend with us, and it was really worthy spending with us, I hope, because you have enlightened almost 200 and more of the audience. Very important topics. Thank you, sir.
Thank you very much. Thank you.
With this, we close the session. Dear audience, we'll meet again next Monday with a different important topic, but substance use and addiction topic. So meet you next Friday on 20th.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Mahadevan, for attending. Thank you, sir. I thank all the participants for the session. Hope it just enlightened all the audience.